The FSU College of Medicine Clinical Learning Center is a state-of-the-art teaching and assessment facility that provides opportunities for medical students to learn clinical skills in a simulated clinical setting. 12 examination rooms are equipped with the latest in clinical and audiovisual equipment. Students learn and practice skills such as interviewing patients to obtain a medical history, conducting an appropriate physical examination, documenting findings, developing treatment management plans, and counseling patients. In addition, students are videotaped for learning and assessment purposes. Training simulators and models are used to teach clinical assessment and intervention skills such as heart and lung sounds and venipuncture. The mission of the Clinical Learning Center includes providing an interactive, supportive environment for students' learning of clinical skills. Teaching strategies include the use of standardized patients. A standardized patient is a person of any age who has been trained to portray an actual patient by simulating an illness or other physical findings. Used in more than 75% of medical schools, standardized patients are typically members of the community who are interested in making a contribution to medical education. Unlike real patients, standardized patients are available anytime and are trained to provide constructive feedback to students about their communication skills. College of Medicine faculty members also provide feedback to students regarding the key clinical skills being taught. In addition to working with standardized patients in the Clinical Learning Center, students will have the opportunity to learn with high-fidelity patient simulators in the Charlotte E. McGuire, MD, and Tallahassee Memorial Hospital Center for Clinical Simulation. The high-tech mannequins in the Simulation Center will enable students to observe the effects of medical interventions on patient vital signs such as blood pressure, breathing, pulse, and heart sounds.
The Clinical Learning Center, fondly referred to as the CLC, is actually a fascinating part of the medical school. It allows medical students to gain a head start with respect to interviewing patients. Each room is fully equipped with the tools you find at any standard clinic. With an examination table, medical students not only have an opportunity to practice patient history taking, but they're also able to perform physical examinations with standardized patients. So as soon as medical students matriculate into the medical school, they're essentially thrown into a practice of taking patient histories and performing physical examinations as part of a well-established and integrated portion of the curriculum. And with the skills and practices that medical students learn from these patient encounters, they're able to not only serve the underserved in the local communities, but are also able to employ their skills internationally as part of international student organizations here at the College of Medicine. So essentially, the CLC actually has an overarching purpose, and I believe it's been quite successful in ensuring the progress of our medical students with respect to clinical education.